forward how to harmonize things and get all your views together. Kotecha ji.
Thank you, Dr. Anurag ji, co-chair of this session. Dr. Ashutosh Sharma ji, Indian National Science Academy, INSA, and former Secretary DST. Moderator of this session, Professor Anurag Agrawal, Ashoka University. Dr. Aditya Burman from Dabar. Dr. Madhuri Kanitkar ji, Lieutenant Vice Chancellor of Maharashtra University of Health Sciences. Actually, when we talk with each other, I fondly remember her version of MUHSS as the M stands for Military University of Health Sciences. So she has brought in a transformation of MUHS, and we are really thankful to your good self, Dr. Madhuri ji. Dr. Mitali Mukherjee, IIT Jodhpur, Professor Tanuja ji, the Director of ITRA Jamnagar, Professor Anil Acharya ji, DG CCRS, distinguished guest faculty members, experts, researchers, policymakers, and all young audience. Namaskar and a very good evening to everyone. It's both a privilege and moment of deep responsibility for me to address this session as the chair. Earlier today, I had the opportunity to speak on the theme Restoring Balance, Scaling Up Access to Traditional Medicine for Health and Well-being. That address was a call for equity, accessibility, and the global integration of traditional medicine in the pursuit of holistic health. In this session, we focus our lens more sharply on a critical pathway that connects academia to policy, science to society, and tradition to innovation. We are gathered here not just to reflect, but to reimagine, to explore how India's rich traditional knowledge systems can contribute meaningfully to contemporary healthcare and drug discovery, and how our policy ecosystems must evolve to support this synthesis. In the earlier session, we had a great panelist participated, an eminent doctor from Bhutan, Dr. Soumya Swaminathan ji, the former principal scientist and former Secretary Government of India. She was also there. Aditya Burman ji is also here. He was there. And among the panel, we also had the regional director of WHO Siro, Ms. Samia Wazed. She was also there. And there was a young participant, a pharmacist, Tanushree Jain. She was there. So we had words and wisdom from all across the scientist community, the young people, the academia, the industry, and collectively we thought about how to bring in the traditional medicine in mainstream ecosystem through different pathways. We also had a panelist from Germany, a professor from Charité University, and there was discussion about the high-end evidence generation. There were discussion about the business model to bring in traditional medicine into the mainstream, and not only evidence generation, but then there are different perspective of traditional medicine and its importance into the resilience and into the restoring balance between this conventional health system and traditional health system. We all know that traditional health systems across the world have grown from the soil, wisdom, and live experiences of communities over millennia. These systems are not merely health services. They are complete ecosystems of healing that emphasize harmony between the individual, the community, and nature. India is proud to lead by example in this global renaissance of traditional medicine. One of the most significant milestones in this journey has been the establishment of the Global Traditional Medicine Center by WHO at Jamnagar. This center is the first and only WHO global outpost dedicated exclusively to traditional medicine. It is envisaged as a global platform for research, innovation, policy dialogue, and capacity building. India has supported this and committed for 10 years the support to this global center for traditional medicine. We had a host country agreement with WHO to support this center in India. It is a full-fledged department or outpost of WHO. As Dr. Agrawal rightly pointed out, the story of artemisinin, derived from the Chinese herb quinhao, has become a global symbol of what traditional knowledge system can achieve when paired with modern science. Once a humble remedy in traditional Chinese medicine, it is now a cornerstone in the global fight against malaria. This example is not just a scientific triumph, it is a message of immense possibility. If China could offer artemisinin to the world, why can't India be the next success story? With our rich pharmacopoeia of time-tested herbs like ashwagandha, shatavari, guduchi, why shouldn't the next globally impactful therapeutic discovery emerge from the treasure troves of Ayurveda and other Ayush systems? The potential is vast. What we need is the will, the investment, and the vision to unlock it. Let me also inform the audience that as a 2030 agenda from Government of India, Ministry of Ayush, we have visualized, envisaged to get at least, to establish at least 3 botanicals from Ayurveda as a globally accepted, globally accepted botanical medicine. Not just the food supplement, but globally accepted, visualized, established, research, generate high-end evidences, at least 3. So we have selected 5. And out of these 5, our research council has started working on GLP dossiers, and we also are working with the ICMR to have large-scale multi-center trials, so that by the end of 5 years, at least out of these 5, 3 can become the globally accepted botanical medicine. That is the dream that we are visualizing. Dear friends, our true challenge lies not just in generating research, but it's in ensuring that it travels the full distance from the lab to the policy. I have just given the example. The real impact lies in our ability to translate that research into actionable policy, into clinical protocols, and ultimately into public health outcomes. We must actively work to bridge the academic policy gap. This means developing clear and accessible policy briefs, designing healthcare protocols rooted in evidence, and supporting new drug discovery pipelines within the Ayush framework. At the same time, we must build a regulatory ecosystem that is both scientifically rigorous and facilitative, not a roadblock, but a roadmap. I also would like to mention that as an initiative of the whole of government approach of Government of India and ease of doing business, we did work on the licensing and regulation of the drug licensing of traditional medicine in India. Out of 35 compliances, we have removed 31 compliances. So only 4 are left, and all criminal things were taken off. And is a real commitment of government for bringing in ease of doing business without compromising in the quality aspect. So that is a very good example how we can achieve such thing by a commitment to the serving of the people and bringing something innovative. To drive high-end integrative research in Ayurveda and Ayush, the Ministry of Ayush has launched this Ayurveda Biology Integrated Program, and under this Ayurveda Biology Integrated Program, these 5 botanicals are being worked out. These botanicals are ashwagandha, brahmi, shallaki, boswellia, sunti, ginger, and methika, the dana methi. So these 5 has a lot of proof of concept level research. There are some high-end publications also, but the missing thing is GLP data, GLP dossier and safety studies. That is already going on. We have started working on this. Our DG is here. He is also one of the panelists. He may like to inform more about that. The integration of Ayush systems with mainstream healthcare and the promotion of an evidence-based approach to traditional medicine have been at the forefront of national health priorities as envisaged in National Health Policy 2017. Notable strides in this direction include the co-location of Ayush facilities under the National Health Mission, as well as the establishment of advanced center like the Ayush ICMR, Advanced Center for Integrative Research in different aims, and the Department of Integrative Medicine at NIMHANS. Recently, the CIB of AIIMS, the apex body of AIIMS, they have decided to start an academic department of Ayush in all AIIMS. So this is also a very good new development. So please visualize, once it happens, it is a big step of India, where it has happened, that a department, an academic department is established in AIIMS. And that makes a lot of, stride into the direction of the integrative healthcare system evolution. Furthermore, the extensive network of national institutes and research councils of Ayush plays a pivotal role in delivering Ayush healthcare services and conducting cutting-edge research, generating robust evidence on the efficacy and safety of Ayush intervention. I would like to also mention that recently we had, culled out, we found out, through literary research that we have the Ayush research portal that is hosted at CCRS, and this research portal, more than 43,000 publications are put there in this index, which is only either published in index journals or peer review journals. And we found out that how much publications were done by government institutions. So in last 60 years, until 2040, there were more than 6,300 publications in 60 years. And in last 10 years, from 2014 to 2024, the number of publications is 9,500. So whatever happened in 60 years, there is 1.5 times in 10 years. Friends, we must now think beyond preservation and towards integration and investment if we are to build a world where health is truly universal, equitable, and sustainable. Traditional medicine must be treated as an equal partner in our global healthcare architecture. The challenges we face is non-communicable diseases, mental health, aging populations, environmental degradation, all require comprehensive and integrative solutions. So let us embrace a pluralistic approach which we India have, and it is to be strengthened more, which is evidence-based and centered on patient needs. Let this session be not just a discussion, but a starting point for deeper collaboration between ministries, between systems, between generations of thinkers. Let's reimagine drug discovery and health systems for the last mile delivery. Not just in labs, but in the wisdom of our text, the diversity of our flora, in the live experiences of our communities. I invite each of you to contribute your insights as we move toward a healthcare model that is inclusive, integrative, and innovative. Dhanyavad. Thank you. Jai Hind.
Request you to share the session. What better continuation can there be of a connection between traditional knowledge, science, and the fact that, science came all through history, through observation. And there is not just one type of science. And to ever the pendulum swings between the various types of ways in which science is done. In fact, I'm teaching a Principles of Science course this time in Ashoka. And we talk about the various type of reasoning and how you arrive at the same truth in either direction. But the best person to continue